In this video, I will cover the treatment and diagnosis of interstitial cystitis, also called bladder pain syndrome. Do you suffer from sudden, strong urges to pee, the need to pee more often than usual, or a burning, stinging sensation in the pelvic or genital area? Do you wake up several times at night to use the bathroom? Maybe you feel helpless because doctors couldn't give you any answers and home remedies or medications didn't work. But now you're ready to do something about it. Congratulations on taking this first step. We look forward to helping you get better. If you've already been diagnosed with bladder pain syndrome, then you've probably gone through a whole odyssey, or you were lucky to immediately find doctors who know this disease. Unfortunately, interstitial cystitis is not well known everywhere. Sadly, this lack of knowledge not only leads to long sagas for those affected, but often to ineffective treatments prescribed by doctors and therapists. The symptoms of interstitial cystitis or bladder pain syndrome can be divided into two main groups: pain and frequent urination. If these symptoms last longer than 6 months, they are called chronic, or in other words, permanent. First, let's talk about pain caused by interstitial cystitis. Pain is often felt not only in the bladder and urethra, but also in the lower abdomen, pelvic area, perineum, and rectum. For women, pain can occur in the vagina, and for men in the testicles or penis. However, this pain sometimes only manifests itself as an unpleasant pressure or discomfort. The intensity of this pain often increases as the bladder fills and can subside for a short time after the bladder has been emptied. The intensity of the pain can vary greatly from person to person. It often comes in phases throughout the day, sometimes stronger, sometimes weaker, with no recognizable pattern. If the urethra is affected, sexual intercourse can also be uncomfortable and painful. This, of course, can hurt a person's love life and add emotional strain to those affected. In addition to pain, typical symptoms of interstitial cystitis can include embarrassing loss of bladder control or bladder malfunction in general. Pain or even cramps sometimes occur when urinating. This is often accompanied by a feeling that the bladder cannot be emptied completely or a lack of urinary pressure. Sometimes the urine only comes out in droplets. Let's summarize the typical symptoms of interstitial cystitis once more. First, there can be temporary or permanent pain in and around the pelvic area. And second, urinating is often difficult, as manifested by a weakened stream of urine or a permanent feeling that the bladder is not completely empty. Sometimes there is also uncontrolled loss of urine, also known as incontinence. Okay, so much for the symptoms. But how can you actually know whether you have interstitial cystitis? After all, the symptoms are often the same or very similar to those of pelvic pain syndrome. First of all, you should definitely see a doctor, because only he or she can rule out the possibility that your symptoms have no other causes, such as bacterial, inflammation, or other physical causes. A first conversation with your doctor can often provide information about what is causing the symptoms. And further tests should then be carried out to either discover or rule out the causes. But what if the doctor can't find any concrete causes? What happens if neither bacteria, infections, nor other physical causes are found? What if medication doesn't work? In this case, those affected often go through a long ordeal. Beyond just the physical symptoms, there's also psychological pressure. Many people speak of feeling helpless when doctors and therapies cannot provide relief. Others get stuck in a cycle of trying to manage the symptoms by testing all kinds of home remedies or endless available medications. Instead of treating the underlying cause of the problem, all they can think about is ending the pain and embarrassment. And if this is you, please know this, you are not alone. So many people feel the same way. Besides interstitial cystitis or bladder pain syndrome, various other problems in your pelvic region can cause inexplicable symptoms. This means that classic symptoms such as bladder weakness or infections occur, but all medical tests are inconclusive. A classical example is pelvic pain syndrome. So what can be the cause and what can you do? Let me put it this way. All of these problems can be traced back to tight and sticky tissues in and around your pelvis, coupled with an irritated nervous system. Because nowhere else in your body do so many nerves intertwine with tissue and muscles as they do in your pelvis. For example, a lot of tissue and muscles around your bladder exist to keep the bladder in position, to control urination and to regulate your visit to the toilet. Now, imagine those muscles and tissues that control your bladder become chronically tense or shortened. What will happen then? That's right, the muscles and tissues will put constant pressure on your bladder. This makes it feel like you have to go to the bathroom all the time. There's no infection. Your pelvic floor muscles are just so tense that your bladder is constantly under pressure. And let's go even further. Hard adhesions in the lower abdomen or pubic bone area, so-called trigger points, can have a direct impact on the many nerve cords that extend through your pelvis. This often leads to discomfort in the genital area because these nerves end there. This may sound strange at first. You may think, well, I'm active enough. Why should a few tensions in my pelvis trigger such strong symptoms? And that's understandable. But let me tell you, chronic tension in the pelvis affects millions of men and women every year and often leads to lengthy problems. And it can happen to anyone, regardless of age, of physical activity or fitness level. Because at some point, it's no longer just the tense or shortened muscle together with trigger points. At some point, the nervous system itself is so irritated and develops a so-called pain memory, which can then become a vicious cycle. What do we mean by that? Well, your dysfunctional nervous system can trigger these tensions over and over again, similar to how a dog reflexively tucks its tail in fear. And those tensions then affect your nervous system again. This is also why people often find it difficult to break out of this cycle and why short-term therapy or individual approaches often remain unsuccessful. So, absent any medical findings for interstitial cystitis, a holistic, long-term therapy for chronic pelvic tension is the most promising method to resolve the symptoms and eventually make them disappear completely. If there's one thing I want you to remember, it's this. Chronically tensed muscles can be trained and reprogrammed to stop tensing involuntarily. And that's why I want to encourage you today. For years, we have been treating patients diagnosed with interstitial cystitis, pudendal or pelvic pain syndrome, patients who sometimes have suffered from inexplicable symptoms for years. But there is a way out. What the body has caused, the body can also heal. So take new courage. Become an active participant in your body's health. If you'd like to know more about our treatment concept, write to us or register online for our 12-week intensive online course. Get active, take control of your symptoms and do something about them. You can register for our online course right away and you can find the link here under the video at our website AidPlan.com. By the way, you can start right away after registering. You get access to over 50 videos where we also show you all the exercises. You'll also get a 12-week training plan that shows you what to do day by day. And we'll provide you with information about therapists in your area where you can get additional help. And much, much more. And of course, my team and I are personally available to all participants. You can write to us as often as you want and we'll be there for you. All right then, we'll see you soon. In the meantime, stay strong, stay tuned and get active. You'll be glad you did.